Hello, fellow philosophy and principles of health education and promotion classmates, and hello to Chelsea and Dr. Moses. In my presentation, I will be discussing my holistic philosophy on youth mental health, what I believe about the health education promotion profession, and my background as to why I chose this field. I believe that adolescent mental health can be stigmatizing, which leads to undiagnosed teens and young adults who have dealt with mental health disorders their whole lives without even knowing it. I will also discuss my personal background and why advocacy, my core values, and an undiagnosed anxiety disorder as a teen led me on a path to becoming a health education specialist. This presentation will have a theme of a holistic philosophy. Mental, emotional, physical, and social aspects of a person's health do need to be recognized. Overall long term health of a person can be determined by primary level care, especially where youth mental health is concerned. I'll also discuss my thoughts on what health means. My health education philosophy statement was very important to me to develop, and here it is my health education philosophy. Using a holistic approach to advocate for youth mental health by creating inclusive programs for schools, communities, and individuals through collaboration and consultation to improve the overall health and well being of our future generations, and doing so with empathy, justice, and critical thinking. And very briefly, what is health? Is health solely about food and exercise? I believe health is about the overall whole person. The WHO defines health as just more than the absence of disease, but a state of the whole person's mental, emotional, and physical well being. And I couldn't agree more. How would you define a healthy person? How would you define health? So, what are my beliefs about the health education field? I believe we are collaborators, resources, advocates, and educators as health education specialists. And our job is to create programs to increase quality of life for better health in an individual or community. A collaborator is someone who networks or works with a variety of professionals seeking to do the most good through programs and interventions for their community and the individuals they serve. Health education specialists need to be resources, able to answer questions about public health, vaccines, science, mental health, student health, etc. We are the go to for health info and education. As health education specialists, we also need to be advocating, and I'm sure most of us, if not all of us, are already, but for a certain population, priority population, demographic, and or community through programs and education. There's no doubt we will each be advocating for something that's near and dear to us. And finally, we are educators, which sums up the first three beliefs I have about what a health educator, health education specialist is. We educate to change lives through information and research and being certified through the CHES exam, for example, as well as expanding knowledge by networking and joining organizations. And I'm proud to say I am now an APHA, American Public Health Association member. What influenced my health education promotion philosophy? Again, just summing up my background a little bit, anxiety began for me at a very young age. I had a late diagnosis. My parents didn't get me treated for it. They treated me as a nuisance because of my anxiety, having stomach aches, being very irritated. And I guess one of the other symptoms for me of anxiety was that the panic attacks, always wanting to leave places. Even though I was social and enjoyed my friends and was am very extroverted, I did have that aspect that came along with anxiety of wanting to just get out and leave where we were. So I developed some coping skills, and my coping skill was to drink. Developed that in my 20s, and finally stopped drinking in my 30s, which led me to learning boundaries, self care, and also really recognizing that there are some generational patterns that led me to more of my holistic philosophy. Here's a graphic of my journey to becoming a health education specialist. I did go to school at the University of Central Florida. I became a physical education teacher. I always had an interest in health and wellness, mental health, and public health. Again, I realized I had anxiety, depression in my 30s, sought therapy, got diagnosed, quit drinking in my late 30s, found self compassion practice, got accepted here to grad school, and began or really continued advocating, but began advocating more for mental health and substance use disorders. What is your background in health education? Have you worked in health education or education? I'd love to hear from you all. If you want to inbox me or email me at any time, I'd love to get to know you better and what all of our backgrounds are. Why I chose the field of health education promotion is really based on my core values, which align with the belief about the profession that health education specialists enable individuals and communities to thrive through the following attributes. I believe empathy, justice, wisdom, and freedom are all core values of health education specialists. And here's how they pertain to my health education philosophy. Empathy is needed to see the whole person, what he or she needs, and assess a plan or program that works best for that individual or community. Justice is an integral value of health educators or health education specialists, as we want to be a voice for the voiceless who cannot advocate for themselves. An example would be affordable and accessible healthcare for all. Wisdom is another core value of mine, and in health education and as a health education specialist, can be used to seek deeper meaning other than just thinking and knowing what someone needs. It's really seeking that deeper meaning and stepping outside of yourself in order to do so. And freedom in health education promotion is a value of mine. It means a lot to me, especially when it comes to body autonomy and, again, affordable healthcare. My holistic approach to mental health, especially youth mental health, encompasses the emotional, physical, and social aspects of adolescent health. Why is it that a particular child or children as a whole, youth as a whole, are having so much an increase in mental health disorders? COVID and isolation. They proved to increase mental health disorders in both teens and adults, according to the Surgeon General's advisory in 2021 on youth and mental health. But I do believe that the holistic approach to mental health, yes, we have the mental health aspect, but also we need to keep in mind the emotional, physical, and social aspects. That emotional health is a key component of mental health, and emotional intelligence needs to be taught in schools. Physical health, of course, we need nutrition, diet, exercise for all of our students, knowledge for all of our students. And again, it comes with that accessibility. We know that not every student has access to really healthy food. And the social aspect, we're all wired for community and connection. Again, the pandemic really brought out a lot of mental health disorders for our youth or exacerbated already existing disorders. I wanted to share this quick graphic. Factors that can shape mental health of young people. This is from the Department of Health and Human Services, the Surgeon General's advisory in 2021. This graphic is very similar to the socio-ecological model in Chapter 4 of our textbook. Basically states that society, environment, community, family, and the individual all play a role in the determinants of youth mental health. Adolescent social determinants of mental health are community, family, education, and healthcare. Community is essential to a child's health and well-being. As they struggle with mental health or abuse at home, they need a community to support and advocate for them. Family and genetics play a role, and I believe the environment a child grows up in is crucial to the mental health outcomes of that child. Education and school systems also play a vital role. The quality and level of education plays a role in a student or a child's mental health. And finally, last but not least, healthcare is key. Determining the factor to the quality of mental health in adolescents with access to affordable healthcare is absolutely necessary. What's your personal opinion on what you think the greatest social determinant of youth mental health is? My future in health education and promotion will be to create programs and interventions using holistic mental health education and school curriculums to include emotional health, nutrition, coping skills, self-esteem work, self-concept work, even mindfulness. There are schools already practicing this and implementing this in their classrooms, and they've seen a big change with it. I'd also love to do some private consulting, either with schools or families, healthcare professionals, community leaders in a private workplace or setting. And I will always continue advocacy and advocating for affordable healthcare for all. And briefly, the whole school, whole community, whole child model is a collaborative, unified model for health education in schools. It closes a gap between school and community health programs. If there is a school program or an issue with health at a school, a particular issue, the community is probably also experiencing that issue and vice versa. Behavior change theory or behavior changes need to be applied in the classroom setting and understanding where that behavior is coming from. Collaborative efforts with staff, communities, and families are also key. And what would I add to any health education curriculum to really get to mental health disorders in our youth at the primary level before they really blow up and you get into what happened to me with drinking to cope or substance use, disorders, or even worse, just ending up really, really addicted. And I'm not saying that's the path that everyone who has anxiety as a child or a teen goes down, but it's more common to have substance use disorders or dependencies if you have a already existing mental health disorder. So I think emotional health strategies such as emotional intelligence activities, self-esteem, again, self-concept work, nutrition and exercise, meditation, yoga, dance, even really recognizing fun hobbies for students, and having that be a part of the curriculum. What's enjoyable for them? What's really going to enrich their lives? And understanding of mental health as part of the whole student and really stopping the stigma, making it not an embarrassing topic. And for the students who don't have mental health struggles or disorders, having them have a better understanding of the students who do. And applying my philosophy. I'll be reducing risk, researching, and recognizing. What does that mean? I will be using critical thinking, technology, and collaboration to reduce risk at the primary level, researching the best programs for that particular demographic. In this case, are adolescents and teens, especially those that are experiencing mental health disorders, recognizing that we cannot take a one size fits all approach. That's why I believe in the holistic approach, and always keeping the whole person in mind. With a holistic, empathetic, and collaborative approach to mental health, I will create programs that will consider the whole person. I know I struggled for too long, and no child should have to feel the shame or stigma of a mental health disorder. Working with schools, families, and/or clinical settings as a health education specialist, I can best advocate for youth mental health. Questions or comments? Thank you all for listening and taking the time to go through this presentation with me. Have you or anyone you know experienced a mental health disorder? Do you think mental health should be approached in schools? Do you believe in a holistic approach to health or mental health? Feel free to reach me at any time at nmryan@ufl.edu.